I'd like to present our next presenter for today. Um, Dr. Donaldson, Dr. Kristen Donaldson is an assistant professor of emergency medicine at Stritch School of Medicine and practices clinically as a full-time emergency physician in Loyola's Level 1 Trauma Center in Maywood. As both faculty for medical students and residents, she has been recognized as a top educator, most recently receiving the Emergency Medicine Residency's Outstanding Teaching Faculty Award for 2020. Prior to medicine, she studied public health at the University of Illinois at Chicago and worked for many years as a business strategy consultant in health and life sciences industry. Her early public health work addressed education on drugs and alcohol, interpersonal violence, and sexual health. She then began to focus on youth violence and more specifically, gun violence and the prevention of trauma recidivism. Welcome, Dr. Donaldson.
Unmute. Thank you. Thank you for having me. I feel like the oddball out because I made slides. I don't know how to do this without slides. No, I'm just kidding. So I'm going to share my screen and I'm going to cover some hopefully quickly because I think we have fallen behind, but I will try to make this happen. Can you see my screen? Because I can't see you guys. All right, perfect. So I was asked to kind of cover some trends in gun violence, and I like to start this with one of my favorite quotes from Martin Luther King: "Darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that." The darkness he speaks of in this quote is violence. And as we all know, I'm speaking to my peers, so violence is all around us. And the answer isn't more violence, it's that we need to teach our children and our communities that there's a better way forward. And that because guns destroy the lives of more than just the person that is shot. Over the years, I was inspired to do a lot of this work because many years ago, I spoke to a young boy, he was about 6 at the time, who asked me, and we were working with, I think it was I was working with a little baseball team outside of Chicago. And he had asked me how old I was. And when I told him I was 27, he said, "That's so old. I'll never be that old." And what was sad is that the underlying statement here was that at 6, this boy had already seen so much violence and death in his own community that he truly believed he would not reach adulthood. His statement has stuck with me all these years, and now as a mother of 3 kids close in age to this little boy, it hits home even more how much guns do hurt. They hurt our families, our communities, and they even threaten our future. That little boy needed to know that there is a future, and there can be one without the violence we see every day. As an emergency room physician, I see the individuals hurt by gun violence more apparently day in and day out. And there's stories that stick in my mind to this day. The pregnant mother that was shot while trick-or-treating with her 3-year-old, the promising college senior that he spoke with me. I was the last person he spoke with. And he had fear in his eyes, and I tried to comfort him. And then dealing with an entire family, including multiple children that were murdered and survived only by a mother who just happened to be out on a date that night when the shooting occurred. And there's more than one of these, but the sobbing mother that laid at my feet crying when I told her that I couldn't do anything more to help her son who had been shot that night. We do heroic efforts to address gun violence, and we see this across the city and across the nation in our trauma base. And these stories make this problem real, and it's up to us as a group, and that's why we gathered here today to find real solutions. When it comes down to the numbers, gun violence is the leading cause of premature death in the US. It kills about 38,000, which is a year, which is equivalent to about how many die in car accidents. And it injures up to 85,000 people each year. In Chicago alone, in 2019, we had about 2,500 shootings with almost 500 homicides. in 2020, that number jumped to over 4,000 people shot, with 769 killed. You know, anecdotally, I felt this last year, we were seeing a lot more violence in our ER. And it's alarming given the other struggles that everybody is facing in these times with the pandemic. Now I've seen the numbers, and they speak volumes, because we have seen a significant amount more gunshot wounds and injuries in our ED and in our Maywood community. We have a trauma registry that, and demographically, you know, over the last 7 years, we've been tracking traumas from gun victims, and we've had about 1,200 patients seen at Loyola. The average age is around 27, and 90% of them are young men. About 17% are Latinx, and 64% are Black non-Latinx men and women. We have about 55% of those injuries are assault based. Another 17% is accidental, and then there's about 4% that is suicide or self-harm attempts. And so these numbers, when you think about it, 79% of, we've talked about those emerging adults, 79% of injuries they're less than 35 years old. This is also 72% of our deaths are less than 35 years old. So these are young men and women in our community, and mostly men, that we are seeing hurt by this epidemic. This is a view of those 7 years by month. Looking back, we can see that 2020, it has the tallest bar. So it is by far one of the worst years we've seen in Maywood in a while. In 2019, we had about 149 injuries seen in the ED or trauma bays at Loyola, while in 2020, this jumped up to 247 injuries, confirming that suspicion that many of us in the emergency department suspected, that we were watching way too many young people roll through our doors with gunshot wounds this last year. This is just the same information, but in a different view, if you like to see those curves and showing the trends. That dark blue curve on top is the 2020 year, and the yellow, which was 2017, which was our next worst year, with about 222 injuries. In 2020, about 10% of the injuries actually occurred in Maywood. So as an area or regional trauma center, we do see patients from outside of the Maywood catchment zone. But these are specific in our registry. These are 10% occurred in Maywood, and about 15% of the injuries were actually Maywood residents. So as you can see, and we found over the 7 years cumulatively, about 84% of our patients survive, leaving a large potential burden of injury and long-term effects that we as a community have to deal with and address. This is just a quick look at just 2020. When you look at it, I also, in light of COVID, I kind of threw in the shelter in place order there. You can see that broken out by a month, you can see that we tend to have trends where we see more injuries in the summer and warmer months, but these trends, these are real people. These are our neighbors and families that are hurting because of gun violence. Mm-hmm. On top of that, we have been faced with this pandemic in 2020 that has affected so many aspects of our lives. And now this is hot off the presses from JAMA earlier this week or last week, showing that we're seeing trends showing rises in mental health visits, overdoses, particularly the opioid overdoses, as Kim Fox had spoken about, that this is one of our worst years. I think the Cook County Medical Examiner has, we've had like almost 1,600 opiate deaths this year just in Cook County. And other forms of violence such as interpersonal violence, suicide attempts, and child abuse and neglect. These all seem to have taken a big uptick in 2020. Now, this is just me playing, so this is not truly scientific map, but when you lay those curves over, I kind of through a combined view of the Maywood firearm injury data and this JAMA mental health and overdose data for 2020, where we saw an increase of basically all forms of trauma, particularly from March through September, with a dip in July. And I don't know, was that related to some of the loosened social restrictions we saw in the midsummer, which then returned later in the fall? But in the end, past research on these public health crises, such as COVID, show that the impacts far outlast this emergency crisis period. And even in that crisis period, we are looking at such an increased burden that it just underscores our need to strengthen our prevention efforts at the individual, community, and societal levels. This is just a glimpse of the burden of trauma in all forms that we are seeing in the community that we serve here at Loyola. And back to that darkness. So that darkness, that burden that I talked about, the costs associated with violence, their financial, their social, and psychological costs. And that's what creates this need for the public health approach that we are building today as a coalition for the prevention of violence. There are studies out there that say the cost of firearm injuries estimated to be up in the range of $230 billion a year. This includes healthcare, law enforcement, insurance costs, employment loss. Imagine the good we could do. Imagine how bold we could be if we could prevent these costs and actually use them for other things, right, in our communities. Yes, the darkness persists, but events like recent violent deaths and mass shootings have started to push the narrative and bring to light what we need to do to stop the hate and violence that is so prevalent in our society today. And its violence in its many forms is preventable. And it is the public health crisis that we need to continue to address. And that's the work we're doing now. It's being described by so many collaborators today. This kind of work gives me hope that we are providing a greater focus on prevention and reducing violence in our communities by addressing the underlying factors. Loyola Stands is a multidisciplinary committee, which many people in this group are part of. I see many faces that I recognize, that formed in 2017 as a collaboration to support patients and family members by gun violence, and grew from there. We're working with the Loyola community, Maywood, and other surrounding communities to make strides in addressing those underlying issues that have an association with violence, such as lack of jobs, concentrated poverty, drugs and alcohol abuse, lack of education, and absence of trauma recovery resources. Some of the programs that we've got in the works or have been working with is there's an AmeriCorps partnership for certified nurses assistance program to provide training and local jobs to our community members. Stop the Bleed programs and other educational activities such as today's conference, including community grand rounds on topics identified by the community, are some of the educational programs we have out there. Our chaplain ministry has done great things with Mother's Dawn gatherings to support mothers and other family members of victims of gun violence. And then the data analysis and academic presentations on the scope of gun violence that we're facing in the Loyola catchment area, and then taking that a step further and developing partnerships with the community and police to address this gun violence. We've also worked on a regional network collaboration to explore the feasibility of a community-based trauma recovery center model, and hope to strengthen that network in the coming months and years. And then perhaps one day be able to develop a center to address trauma recovery in our own community. And then as we move forward in 2021, Loyola Stands will work with community partner organizations to explore the prospects of social enterprise in the village of Maywood via our R3 planning grant to address that disinvestment that Kim Fox spoke about earlier. And all of this work and the work that everyone here has been doing is spreading that light and spreading the love that MLK spoke of so long ago, to save lives, to build healthier communities, and to stop the violence. Let me stop my
Thank you, Dr. Donaldson. As the end of each presentation, I think, gosh, there's so much more to say, and hopefully the coming weeks and months will be the time where we continue to discuss and to use these partnerships as we move forward. So now we will transition into a presentation by Dr. Kelly Henry. Dr. Henry is an assistant professor at Loyola Medical Center. She's board certified in internal medicine and pediatrics, who also specializes in palliative care. She has an interest in gun violence prevention and is co-lead for the Be Smart campaign in Elmhurst, Illinois. Be Smart is an organization that is dedicated to improving awareness on secure gun storage practices, which can save children's lives. She also recently joined Doctors for America subcommittee on safe storage and hopes to improve physician counseling of patients and their families on safe storage practices. Thank you, Dr. Henry.
Thank you. All right, let me share my screen. I also have slides, so. Okay, so I'm hoping you can see my screen now. Yes? Okay. So thank you for the introduction. So I'm Kelly Henry. I am a MedPeds faculty member here at Loyola. And one of my things that I'm interested in is improving physician counseling on safe storage of firearms. And so I wanted to talk briefly about this important topic. Mostly I'm going to spend some time on the background of why I think this is such an important topic, since I don't have that much time to cover everything. But we're hoping to have some sort of training session later in the spring, so we can talk more about it at that time. And just real quick to bring COVID into the mix, like every other presentation, with COVID happening, we are seeing a surge in gun sales, and surveys are showing that the majority of people that are buying guns during this pandemic are buying them for personal protection. And those kind of guns are most often not stored securely. And so this is even more of an important topic in the timing of COVID. And the people that are buying guns have higher rates and incidences of anxiety and depression. So it's a different type of gun owner that are purchasing new guns at this time. So I think this is just all the more going to be a more important topic. And so just to go what Jenny had said, I'm also a member of the Be Smart campaign. So this is a program to bring together parents and all adults concerned for kids' safety and guns. I'm part of my lead in my local community chapter. So I've had the opportunity to give presentations to the local community groups and schools. And the Be Smart acronym stands for Securing Guns in the Home and Home of Vehicles, Modeling Responsible Behaviors, Asking about Unsecured Guns in the homes that your children visit, recognizing the role of guns and suicide, and again, building awareness on this very important topic. So I also have some slides just for some background on why this is important. So in 2018, just to go like what Dr. Donaldson was saying, there's almost 40,000 firearm related deaths in the US. That's about 109 people every day dying from firearm related injury. And while mass shootings often make headlines, you see that that makes up a very small percentage of gun deaths in the US, with 2/3 of gun deaths are actually suicides and 1/3 are homicides. So specifically gun violence in children, car accidents are the leading cause of death in children, but actually firearms are the second leading cause of death in children in the United States. And they are the leading cause of death in children specifically in Illinois. They are also the leading cause of death in children, in Black children. In Illinois, Black children are 13 times as likely as their white peers to die of gun violence. Every year, 1,500 children are killed by guns. 800 are homicides, 600 are suicides, and 100 are unintentionally killed. So I also wanted to address the role of firearms in suicide. So suicide is the second leading cause of death, and this is from the CDC injury report, is the second leading cause of death from age 10 to age 35, and it becomes the third leading cause of death for young adults 35 to 55. So again, 24,000 people died by gun suicide in 2018. So guns play a major role in suicide pandemic in the United States, and 40 to 60% of child suicides involve a gun, and that's actually increasing as the years increase. How long do you think someone actually contemplates suicide? There was a study done that looked at adolescents and that attempted suicide, and they said they usually contemplated suicide about 5 to 10 minutes before they did it. So you can imagine when you have an easily accessible firearm, that increases your chance of a lethal form of suicide. Death by suicide is 5 times more likely in homes where firearms are present. So what do we know? We know that about 1/3 of households in the United States contain at least one firearm. We know that there are 4.6 million children that live in a home with at least one loaded and unlocked gun. We know children under 13 that most gun homicides actually occur in their home. And we know that 90% of unintentional shooting deaths occur often in the victim's home. And we know that children as young as 2 years old have the tensile strength to pull a trigger of a handgun. So that is obviously very concerning. And then when it comes to school shootings, when it comes to incidents on school grounds, 78% of young shooters obtain the gun from their home or the home of a relative. So I just wanted to briefly talk, because it's always important to kind of give it some context about some consequences of what unsecured guns look like. And so these are some headlines from stories across the country. So at the top left, in January 2018, there was a school shooting at a Kentucky high school. 16 people were shot and 2 people were killed, Bailey Hope and Preston Cope. The 16-year-old shooter gained access to his stepfather's firearm, unsecured firearm in his bedroom. In the top right corner, this was a story from May 2018. There was a 4-year-old boy from Louisa, Virginia, who unintentionally shot and killed his 2-year-old brother, Tyson, after accessing an unsecured gun that was kept really high in an upper cabinet. The next headline, the bottom left, illustrates when kids carry guns out of fear, easy access facilitates the cycle of violence. And the bottom right, our final story is about a 13-year-old Mikey from New York. He was a popular 8th grader. He was an athlete. He liked to play video games. And one day he came home from school. He took his father's unlocked and loaded gun and he shot himself. His family knew him to be happy. They don't believe he intended to die that day. But unfortunately, with easy access to a gun, Mikey made a very impulsive decision that became a fatal one. And I also wanted to just touch base that this isn't just a pediatric concern. There's adults that we also need to be doing a better job of counseling. So I wanted to share one other story. This is a story about a woman named Dee. She was 75 and she accidentally was shot by her husband, Daryl, who was a former local police chief. He had been diagnosed 2 years earlier with a form of rapidly progressive dementia. He was unable to talk and he was unable to walk. He was in a wheelchair, but he was still able to discharge his handgun, unaware that he almost killed his wife at 57 years. She said he just didn't understand. She required 3 surgeries to survive her injuries. While all 5 of these stories are very different, they all show what happens when young people and those who are at high risk gain access to unsecured guns. And I believe they're all tragic and they're all preventable. So what is safe storage? So how many of you guys, when you were little or younger, you went and you searched for holiday presents or Christmas presents, birthday presents? Probably you found them. Guns are not any different. 13 million children live in a household with at least one gun. And studies show that the majority of these children know where the gun is located. And 1/3 of the children have actually admitted to handling it without their parents' knowledge. So what does it mean when we say safe storage or secure storage? It means storing guns locked and unloaded with ammunition stored separately. Hiding a gun is not securing a gun, like the story we heard about the Virginia boy who shot and killed his 2-year-old brother. And we know that responsible storage is associated with a decreased risk of firearm suicide and unintentional firearm injury among children. So who should we be counseling? I just wanted to briefly mention, obviously, children and adolescents should not have their hands on unsecured guns. Patients that are acute risk of violence to self and to others, so this is an emergency, those with suicidal or homicidal ideations. People who have individual risk factors, so if you have a history of violence, if you have a history, of drug and alcohol use. So alcohol use is common among firearm owners, and it's a well-established risk factor for interpersonal and self-directed firearm violence. And then self-directed violence is also strongly linked to mental illness. So those with serious mental illnesses can have a suicide risk factor that's increased by 10%. And then dementia and cognitive impairment, those patients are, again, ones that should not have their ability to have access to an unsecured weapon. And then demographic groups that are increased risk. So these patients are also ones that we should be counseling. So young African-American men are more likely to die from homicide than young white men, and middle-aged and older white men are much more commonly likely to die from suicide. So that's another age groups that we should also be counseling on safe storage practices and counseling further. And so, you know, we know that there's a large body of evidence that says safe storage leads to reduction in suicide and unintentional injuries. So why aren't we still talking about guns in the clinics? So I thought this was just interesting, and this is my last slide. I just want to point out the significance of this. So almost all pediatric residents that were surveyed stated we should be talking about gun safety with our patients, but 2/3 said that they never have counseled, or they counsel less than 5% of their patients. When they did a survey of adult primary doctors, 2/3 of adult PCPs stated that they never asked about guns in the home. And there was a study that looked at veterans with suicidal thoughts, and they found that only 15% of providers documented firearm access. So this is a super important topic, and it's something that as physicians and healthcare workers, we should be talking about with our patients, and there's a variety of reasons why we're not. And I'm hoping that we can do a training later in the spring to kind of go over how we can counsel patients and do a better job of counseling patients. So thank you.